Are you living with a condition affecting your bones, like multiple myeloma or bone metastases? A new treatment option, Xtrenbo, has just received FDA approval. Let's explore what this means for you and your bone health journey. Xtrenbo-denosumab-qbde is a newly FDA-approved medication. It's a biosimilar to xgeva, denosumab, a well-established treatment for various bone conditions. Xtrenbo received its approval on September 26, 2025. A biosimilar is a biological product that is highly similar to an already approved biological medicine, known as the reference product. There are no clinically meaningful differences between a biosimilar and its reference product in terms of safety, purity, and potency. This means you can expect similar benefits and risks. Xtrenbo is a type of medication called a rank ligand, RANKL inhibitor. RANKL is a protein in your body that plays a key role in bone breakdown. It signals cells called osteoclasts to dissolve bone tissue. By inhibiting RANKL, Xtrenbo helps to reduce this excessive bone breakdown. This action can help strengthen bones, prevent bone damage, and manage conditions where bone loss or destruction is a significant problem. It essentially helps to rebalance your body's bone remodeling process. Xtrenbo is approved for several important uses related to bone health. It offers a new option for patients facing specific challenges. Always discuss with your doctor if Xtrenbo is right for your condition. Xtrenbo is indicated to help prevent skeletal-related events in two groups of patients. These events include serious bone complications like fractures, spinal cord compression, or the need for radiation or surgery to the bone. It is approved for patients with multiple myeloma, a type of blood cancer that often affects bones. It also helps patients with bone metastases from solid tumors, meaning cancer that has spread to the bones from other parts of the body. This medication is also approved for adults and skeletally mature adolescents with giant cell tumor of bone. This is a rare, non-cancerous tumor that can be aggressive and cause significant bone destruction. Xtrenbo is used when the tumor cannot be removed surgically, or when surgery would likely lead to severe complications or loss of function. It helps to manage the tumor and reduce its impact on the bone. Finally, Xtrenbo treats hypercalcemia of malignancy that is refractory to bisphosphonate therapy. Hypercalcemia means having abnormally high levels of calcium in the blood, often due to cancer. When standard treatments like bisphosphonates haven't been effective in lowering calcium levels, Xtrenbo provides an alternative. High calcium levels can cause serious health problems, so effective management is crucial. Xtrenbo is given as an injection. Specifically, it is administered via subcutaneous injection, which means it is injected just under the skin. This is a common method for many biological medications. The medication comes in a single-dose vial. Each vial contains 120 milligrams of denosumab-qbde in 1.7 milliliters of solution, making the concentration 70 milligrams per milliliter. Your healthcare provider will administer this injection. The FDA approval of Xtrenbo was based on a thorough and comprehensive review. This process involved evaluating extensive data to ensure its safety and effectiveness. The data package included analytical, non-clinical, and clinical studies. These studies demonstrated that Xtrenbo has similar quality, efficacy, how well it works, safety, and immunogenicity, how it affects the immune system as its reference product, xgeva. This rigorous evaluation provides confidence in Xtrenbo as a reliable treatment option. Like all medications, Xtrenbo comes with important warnings and precautions that you should discuss with your doctor. Being aware of these can help you monitor your health during treatment. Your healthcare provider will assess your individual risk factors. One important concern is hypersensitivity reactions, which are allergic reactions. These can range from mild to severe. If you experience any signs of an allergic reaction, seek immediate medical attention. Hypocalcemia, or low calcium levels in the blood, is another potential risk. Your doctor will likely monitor your calcium levels and may recommend calcium and vitamin D supplements. It's crucial to follow these recommendations. Osteonecrosis of the jaw, ONJ, is a rare but serious condition involving bone damage in the jaw. Maintaining good oral hygiene and informing your dentist about your Xtrenbo treatment are very important. Report any jaw pain or unusual symptoms promptly. Atypical femoral fracture is another rare but serious bone issue. This involves unusual fractures in the thigh bone. Report any new or unusual thigh, hip, or groin pain to your doctor right away. For patients with giant cell tumor of bone and growing skeletons, or those discontinuing treatment, hypercalcemia can occur. This is a rebound effect where calcium levels can rise after stopping the medication. Your doctor will monitor you closely. Finally, multiple vertebral fractures can occur following treatment discontinuation. This risk is particularly relevant if you stop Xtrenbo suddenly. Always consult your doctor before stopping any medication. Understanding potential side effects can help you know what to expect during treatment. The common adverse reactions vary slightly depending on the condition being treated. Always report any new or worsening symptoms to your healthcare provider. For patients with bone metastases from solid tumors, common side effects include fatigue or asthenia, weakness, hypophosphatemia, low phosphate levels, and nausea. These are generally manageable. If you have multiple myeloma, common reactions may include diarrhea, nausea, and anemia. Other possible side effects are back pain, thrombocytopenia, low platelet count, peripheral edema, swelling in limbs, and hypocalcemia. Upper respiratory tract infection, rash, and headache can also occur. For those treated for giant cell tumor of bone, common side effects include arthralgia, joint pain, headache, nausea, and back pain. Fatigue and pain in an extremity, arm, or leg are also frequently reported. Patients receiving Xtrenbo for hypercalcemia of malignancy might experience nausea, dyspnea, shortness of breath, and decreased appetite. Headache, peripheral edema, vomiting, anemia, constipation, and diarrhea are also common. Xtrenbo is the 7th FDA-approved biosimilar to xgeva. This means there are now multiple options available that are highly similar to the original reference product. Other xgeva biosimilars include Wyost, Xbrake, Osenvelt, Bomentra, Bilprevda, and Ocalso. Interestingly, denosumab is also the active ingredient in Prolia, another medication used for osteoporosis. Xtrenbo's generic name, denosumab-qbde, is also approved as Enabi, a biosimilar to Prolia. This highlights the versatility of denosumab. Enabi, denosumab-qbde, was also approved on September 26, 2025, as the 7th biosimilar to Prolia. This means that the same active ingredient, denosumab-qbde, is available under different brand names, Xtrenbo and Enabi, for different indications, reflecting its biosimilarity to both xgeva and Prolia.